Morning, everyone. My name is Rishabh, and today we are joined with Dr. Mansi for another podcast. To give you a bit of background about Dr. Mansi, she is an assistant professor currently in GD Vinca University. To tell you a bit about her education background so that you have a bit of context as to where this conversation comes from, she has done her MA and BA in the field of psychology, and she has also specialized her PhD in clinical psychology. And the focus of today's podcast would largely be on the topic of psycho-oncology. Why is it essential, and why should it be more incorporated in the system of the cancer healthcare system? So, welcome to the talk podcast, Dr. Mansi. It's a pleasure to have you here.
Thank you.
So, if I had
Same
to
here.
ask you, if someone is not from a medical background, like me, for example, I'm a BBA graduate, or someone who doesn't really understand the depths of psycho-oncology, what would you explain to them as to what is this entire field about?
Firstly, we need to learn or understand the terminology of psycho-oncology we are talking about. So, if we break these two words, so psycho means the psychological or the mental aspect of any kind of, maybe it can be patient or maybe it can be the attendant who is taking care of the cancer patients. The second word is oncology, in which we studied the treatment and how to deal with the cancer patients. So those psycho-oncology is a field of focuses on the mental and emotional aspect of a cancer care. So if a person who is not from the medical background, but they realize and they should be recognized the cancer affects not just the body, but also a person's mind, its emotions, and the overall the quality of life. So, like, think of it that there is a bridge between the psychology and the cancer treatment. So, psycho-oncology brings a unique perspective to the cancer care by looking at the whole person, not just the disease. It also addresses the anxiety, the depression, and the stress that often comes with a cancer diagnosis, help patients and their families to develop their coping strategies. So the aim of improve overall well-being, this field focuses on the improving communication between the patient and their families, also with the healthcare provides like long-term psychological effects. There should be even after the treatment ends by integrating mental health support into the cancer. Um, we can say that the treating cancer involves more than just the treating physical symptoms. Also, I think the physical symptoms more than the medical symptoms would be there, as well as in the patient and to their cancer, the caregivers also. So it consists in supporting the person's mind and their spirit as well. So the holistic approach can significantly improve a patient's the quality of life and the ability to keep with the challenge of cancer diagnosis, their treatment, and their supervisorship. So we can say the unique perspective it brings to cancer care includes like it can be a holistic approach where there is no need to be the medical background, because we are generally using these terms like anxiety, stress, depression, because cancer is not have a specific age criteria. It can happen in any age criteria, right? So it
Yeah.
comes in the whole person's, not just the disease. Secondly, we can concern about the mental health, because they require a kind of a support from their society, from their community, from their family, from their close ones. Third one is coping strategies, because once we got to know that we have some chronic illness, so it's very easy to be happen like some kind of stress, some kind of trauma. So we need a coping strategies, how to be resilient with that particular situation. Next one is we need to focus the quality of life, because it aims to be improve our overall well-being in the patient, not just the treatment purpose, but yeah, to live till then they can, right? Next one is like communication, because it helps the improve the communication between the patient and the doctor. Sometimes it happens that each and everything we can't explain to the patient and to the caregivers, as well as patients also cannot be express themselves in front of the doctor. So there should be a bridge between that. And like I think these things can be improve a patient's well-being totally. It's my understanding.
So, like you said, that it's more on the mental health aspects apart from the physical treatment that psycho-oncology deals with. So, I can assume that people who get cancer belonging to different age groups, be it an adolescent, a teenager, someone in the age group of, middle aged or even elderly. There are spectrums of the age groups to which cancer can be affected. And ये सारे लोग का mental toll and mental pressure is very different. And how we address to this issue is also very different. So if I had to give you a bit of, age group from ascending order, let's say from zero all the way till 80 years or 100 years. In age groups में as the life progresses and जब cancer आता है at any of these stages, are they treated any differently या फिर सबको similar mental health treatment एक तरह से we provide? Could you tell a bit about that?
See, like if we are talking about the age criteria, so there are age criteria, their anxiety and their stress level would be different. Because like मान लीजिए, sudden you got a person got married, and after a few years still he has no kind of children, they have their specific life uh, schedule, or maybe something like different. So he has that kind of stress and anxiety. What his or her family will do if he got something, yeah, if happened something with him. So he has that kind of stress level. If we have a child and he got suffered like cancer, so his or her parents would leave, not he or she. Like अगर कोई बच्चा है तो उसके
हाँ.
पेरेंट्स को ज्यादा इफेक्ट होगा कंपैरेटिवली उसके खुद को. पहले like if we talk about the earlier like few years back, so the caregivers treated a cancer patient is like I have seen so many patients जिनकी families उन्हें छोड़ करके चली गई. They were abandoned. There were no caregiver who was taking care of them. So they feel like loneliness. It was like no one is there for caring him or her. Right? So we can deal with the like cancer population, we can say like such as children, adolescents, and caregivers, and we can handle differently of different age group. ठीक है. So अगर हम बात करें, so the fact, adult patients benefit from the cognitive behavioral therapies. If we are talking about the psychology, couple counseling, older adults may we can receive the help and the maintaining like independence, addressing end of life concerns. So caregivers are offered like stress management techniques, education on the patient care, because at the age of one, एक ऐसी age कैंसर की जब fourth stage की हम बात करते हैं, where the patient needs only the palliative care. Sometimes it happens with me that I've taken care of a patient and मैं उसे अच्छा भला छोड़ करके आई हूँ, and next day when I go to him I got to know कि oh he is on ventilator. तो यानी कि एक रात में बहुत कुछ हो जाता है and nobody knows about it, right? So if we are dealing with the age criteria group, so psycho-oncology addresses the unique needs of different cancer populations, tailoring approaches to suit like specific challenges and the development of the stages. अगर हम बात करें कि we are dealing with the children, so we can use the play therapy, art therapy, because it helps to children express their feelings. Like age
Hmm.
appropriate explanations of the cancer treatment, like we can do the family centered interventions to help the parents support their child. If we are talking about the adolescents and the young adults, so we can focus the identity issues, यानी कि body image concerns, because जब हम कीमो ले रहे हैं तो हमारे बाल झड़ जाएंगे, या अगर मान लीजिए किसी फीमेल को ब्रेस्ट कैंसर हो गया, so she concerned about the body image. Are you getting my point?
Hmm.
So we need to support for the treatment relate the fertility issues also, as well as
Okay.
females maybe or males maybe. So sometimes like males who are concerned about their family concerns, family issues, so they need to preserve their fertility. They like their sperm can be stored,
Mm-hmm.
right? Same as well as अगर uterus cancer हो गया या ovary cancer हो गया, so the fertility chances would be down. So peer support group and the social media interventions like guidance on education and cancer planning, interruptions are important because education उस level पे नहीं है, although we have some kind of interventions. Like अभी बहुत सारी चीजें आ गई, like we can store our sperm कि कुछ time के बाद we can take out it.
Mm-hmm.
But education is not on that level. So if we are talking about the adult patients, so we can use CBT for managing their anxiety and depression, couples counseling for relationships, like intimities issues can be there, return to work support, financial counseling to address treatment related to the financial stress as well, because the cancer treatment is so high. Older adults की अगर हम बात करें, so we need to use the strategies to maintain independence during their treatment. They need support managing like multiple health conditions, because जब हम सर्जरी की बात करते हैं, I have seen so many patients that they have so many comorbidities and we are not able to do the surgery. किसी का बीपी हाई है, किसी को किडनी में प्रॉब्लम है,
Mm-hmm.
किसी को कुछ है, किसी को कुछ है, so they need a managing multiple health concerns. Addressing end of life also concerns because in advance they need a palliative care plan. And mentally we need to prepare. देखो कोई भी इंसान किसी भी एज में जाए, but we mentally can't say कि हाँ ठीक है जा रहा है तो जा रहा है.
Yeah.
They need such kind of support that mentally patient as well as their family members need to understand that he is at their end of the life palliative care and anything can be happened at any time. So
Mm-hmm.
cognitive rehabilitators of those expressing like chemo brain and caregivers के लिए it important because they have a lot of stress, so how they will manage their stress and their self care techniques. Education on patient care and symptom management because they need to understand कि आपको किस तरीके से उन्हें केयर देनी है, because जब किसी का पेशेंट कैंसर डायग्नोज करता है तो ये समझ लीजिए कि वो हेल्दी और प्योर चीज खा ही नहीं सकता.
Yeah.
ही टोटली डिपेंड ऑन द डिब्बा बंद जो पैकेट्स में आ रहा है. जूस पीना है पैकेट्स, दूध पीना है पैकेट्स, ना वो फ्रूट खा सकता है ना फ्रूट जूस पी सकता है. तो जो केयर गिविंग दे रहा है, दे नीड टू बी मोर educated, they need to be more technical and manage the things. Also, support groups specific to the caregivers, we can do with the behaviorment counseling sessions and management of their recurrence because जो उसकी टेकिंग केयर कर रहा है, they need to understand कि recurrence chances is high.
Mm.
आज आपने ट्रीटमेंट कराया, रिकरेंस कैन बी डन, कैन बी कम अगेन इन द 5 years और मे बी इन द 10 years. तो मैनेजमेंट ऑफ फील ऑफ रिकरेंस, ऐसा नहीं है कि आज हमने ट्रीटमेंट करा लिया अब हम बिल्कुल ठीक है. एनीथिंग एनी टाइम कैन बी हैपन. So support of the long-term side effects and the new normal adjustment is very difficult. So health behavior interventions like they need to be do for the nutrition, exercise regularly, they need to do career counseling for those who needs for the change professions because earlier he is or he was able to do anything, but after these chronic illness he would not be.
Okay.
Like some in diverse population also.
Okay. And one question that actually came in my mind was that even though we talk about how important taking care of the mental health is, because this is the last stage of the person, and even if let's say if person is not really dying from this, अगर वो stage 3 stage 4 में नहीं है, let's say they somehow get cured due to the operation or due to God's grace, whatever people might say, after the first or second stage, लोगों को पता ही नहीं होता कि मेंटल हेल्थ की इम्पोर्टेंस एंड टेकिंग थेरेपी एंड टेकिंग some mental health support alongside the chemotherapy is equally as important. People think it's only about your sleep, your diet, and the therapy, chemotherapy that you're taking, उससे ठीक हो जाओगे. But because we know that how stress actually impacts the hormones, which impact in turns the internal, cells ka development. which is basically the cancer cells जो multiply rapidly होते हैं. Stress also is a big factor that contributes in it. And obviously, if the mental health is not being taken care of, cortisol, stress levels will obviously be high. So that is equally a big of a factor to, in a way, you can say, it's a double-edged sword. यहाँ तो stress ज़्यादा है तो उससे बहुत जल्दी भी आ सकती है, and the less stress you take, उससे I would say, of course, you have a better chance to surviving. But because people don't think about their mental health as a big enough issue, and they see chemotherapy and the physical treatments as more important, I feel like उसके वजह से भी a lot of, I won't say deaths could be prevented, but a lot of the early stage cancer could be prevented अगर they take therapy and their stress levels are at least reduced. So how would you say कि maybe in the hospitals or wherever the people get treated for their cancer treatment, how can hospitals, have a mandatory or incorporate therapy sessions or caregiving activities or something or the other that relates to the field of psycho-oncology ताकि उनको एक holistic way, एक और what do you say, एक added advantage मिल जाए to tackle the battle of cancer. How do you think hospitals should incorporate this? And I feel like personally काफी हद तक mandatory भी होना चाहिए because this is also a big enough factor to treat cancer.
So, Rishabh, there are so many hospitals where the cancer patients are going to treat. There are one of clinical psychologist available in each and every hospital to taking care of these patients. Like I had said that I had worked with Metro Hospital and Cancer Institute with Dr. Puneet Gupta. Right now, he is in Asian. So also there is a clinical psychologist in his team. But depends like the people who are coming for the treatment, they are not well aware. Like
Yeah.
earlier, when I started to
Hmm.
study psychology, that it was a myth कि psychology पढ़ रहे हैं, that means we are mad, we are crazy. फिर
Yeah.
अभी तक भी there are a misconception and myth in the population or the community that we are not able to accept that mind is also the part of our body और इसकी भी taking care उतनी ही जरूरी है जितनी कि हम physical treatment ले रहे हैं.
Yeah.
So when I
Mansi,
was
sorry to
seeing
interrupt
the
you a second. Could you turn off your video and turn it on again? Actually, your video is paused. So if you can just turn it off and turn it on एक बारी. Yeah, now
now
it's good to
okay.
go. Yeah.
So the myth is like the brain is not a part of our body. So we need to understand that mind's mental health is as much as important as the physical health. So this, uh, like we can say that it is mandatory to keep yourself or you need to checking care with the mental health with the prevention at the early stages. But क्या होता है कि first stage तक there are lack of the population of the cancer treatment who reach to doctor ki okay and they diagnosed ki the patient have the starting phase of a cancer.
Hmm.
तो पेशेंट हमारे पास कब आता है जब उसकी सेकंड स्टेज हो जाती है, सेकंड और थर्ड, बिकॉज फर्स्ट में वो डिटेक्ट नहीं कर पाता. जब
Yeah.
डिटेक्ट कर लेता है तो देयर इज अ 5 स्टेजेस.
Hmm.
फर्स्ट में ही वॉन्ट बी ही वुड बी इन डिनायल फेज कि ये रिपोर्ट मेरी नहीं हो सकती या there is something happened with this my report. So in earlier stages he won't be accept. Secondly अगर वो accept कर लेगा तो there is a aggression, ये नहीं खाना, ये नहीं करना. तो द फ्रस्ट्रेशन, क्योंकि इट्स अ वेरी बिग नेम कि भैया कैंसर हो गया, तो अपने आप में एक
Hmm.
बहुत बड़ी चीज है. और स्ट्रेस कहीं दिखाने की जरूरत नहीं पड़ती, इट्स ऑटोमेटिकली जनरेटेड इन यू,
Yeah.
राइट. तो वो अग्रेशन में निकलता है. फिर उसके बाद ही स्टार्टेड टू कीप क्वाइट कि ओके now this is a phase of depression. There
Mm-hmm.
are 5 Ds we said कि okay denial phase है, then depression आ गया, ठीक है, aggression आ गया. फिर उसके बाद फिफ्थ फोर्थ फिफ्थ स्टेजेस पे जाके ही एक्सेप्टेड कि ओके मुझे है और अब मुझे वही करना है जो डॉक्टर कह रहे हैं.
Hmm.
So they don't started to start their medication. They don't ready for the surgery. So each and every step we need to tell them, we need to counsel them they needed support all the time. ऑल्सो देखो, सिर्फ कह देना कि मेंटल हेल्थ हम बोल रहे हैं कि उसकी केयर बहुत जरूरी है, लेकिन देयर आर सो मेनी फैक्टर्स बिहाइंड अ ट्रीटमेंट ऑफ अ कैंसर, बिकॉज इट्स अ वेरी एक्सपेंसिव ट्रीटमेंट. तो उन्हें भी सोचना पड़ता है कि हमें कहाँ ट्रीटमेंट कराना है, किससे ट्रीटमेंट कराना है, कितना एक्सपेंस होगा. पेरेंट्स, पेशेंट्स के केयर गिवर्स भी ये सोचते हैं कि हम उतना अफोर्ड कर पाएंगे या नहीं, अगर वो किसी पैनल के अंदर नहीं आते, इफ दे आर नॉट कमिंग इनटू दी like any kind of medical insurance. So it's very hard for a general patient to come to the hospital and to do the treatment. और हम गवर्नमेंट में देख ही सकते हैं, देर आर अ लॉट ऑफ लॉन्ग क्यू इन दी वेटिंग इन एम्स हॉस्पिटल एंड अदर्स. So no doubt they require, but the thing is कि counseling we can do, but we can't help them to come out with their other factors or resources. So this is the
Hmm.
basic thing. Yeah, it should be mandatory in each and every hospital, but we need to understand this perspective also.
Okay. And ma'am, for the people who are actually interested to make a career in this field, this is a bit off topic than the actual thing that we're discussing about. But let's say if I'm a undergraduate student who's pursuing a career in the field of psychology and who's interested into going in this field, could you tell the pathway as to how can they reach at a position where they're actually dealing with clients, like the entire pathway की क्या qualification चाहिए होते हैं, क्या certification या क्या skill चाहिए होता है, which are at least the mandatory, because again, not everyone will have the same certifications या skill enhancement course to be better in this, but at least as far as the mandatory things are concerned, which will make you eligible, what would you say to that? उसका pathway क्या है for the students at least?
Rishabh, if we are talking about the psychology background, because we are talking about the mental health. So firstly, I recommend कि at least जो भी कोई इस फील्ड के अंदर जाना चाहता है, एटलीस्ट दे नो MA in psychology is important, because in this perspection we will be able to understand that how many disorders are there, how we can counsel the patient, how can we conduct the mental status of examination, because it is a very important कि हर चीज हमें पेशेंट से पूछनी नहीं पड़ती. Sometimes we need to see and observe the patient, and that is my expertise ki I can say the patient is at in that stage. Okay. So MA is important. Now it's a very good opportunity to all the participants who wants to come in this field, because psycho-oncology in आगे आने वाले term में, it's a promising that with several emerging trends and technologies that have potential and significance enhance the patient care, और उसमें psychology would be the part of that. And people and doctors of the teams like medical oncology teams are dealing with this, and they are trying to make as a team with the psychology. So I think Amity University have that kind of diploma psycho-oncology, and I was trying a lot that time when I was dealing with cancer patients, and I was the single student, and that's why they didn't run that course on that
Hmm.
time. But whatever I had learned, that was my expertise and my experience, because once you started to work with the patients, and how much observing you are, how you are grasping your knowledge after seeing the patients, after um, to be a part of that particular team, because we need to understand that one patient would be dealing with the three at least doctors. One
Hmm.
would be the medical oncology, second would be the surgeon, oncosurgeon, and third would be the जो radiation therapist होता है.
Okay.
Apart from that, nutritionist would be there, and the fifth part is the psychology. Because ये सारी चीजें सब लोग मिल करके देखेंगे, plus the physiotherapy, because exercise is as much as important as the other uh, doctors are doing their work. So no doubt we need to learn at least कि हम किस तरीके से उसको डील कर सकते हैं. उन्हें पता ना चले, but we need to give the at least a therapy at some time. So the education and training, it is important कि हम उन्हें कैसे educate कर रहे हैं, हम उन्हें कैसे medical या professional understanding is important. Integrated case models like हम but multi, it's called a multidisciplinary terms teams. where each and every person are there जिसे
Hmm.
एक पेशेंट को जरूरत है. Secondly, like patient को empower करना, because we need to encourage them as well as to their caregivers, right? So we
Hmm.
need to tell कि हम उन्हें किस तरीके से हेल्प कर सकते हैं, हम उन्हें कैसे मोटिवेट कर सकते हैं, because it is important. Patients easily didn't ready to go for the surgery, so as a psychologist I need to understand and I need to deal with them that they need to go, because like अगर किसी डॉक्टर ने बोला कि यू हैव लाइक 4 years, तो विद द ट्रीटमेंट ऑफ मेडिसिन हम उसे 5 साल कर सकते हैं, बट हम उसका सर्जरी के साथ हो सकता है और 2 साल बढ़ाते हैं.
Hmm.
तो वी कांट अश्योर दैट 100% इट विल वर्क, बट एज अ टीम एज अ डॉक्टर वी कैन ओनली श्योर, वी कैन ओनली ट्राई. सो उनके अंदर जो भी चीजें हैं आई नीड टू अंडरस्टैंड, आई नीड टू काउंसल देम दैट एवरीथिंग वुड बी ओके, because chronic illnesses is always being like they have some kind of afraid things in their
Hmm.
inners, and we
Correct.
need to do like वो चीजें बाहर निकल करके आए, they need to discuss with them. एक पेन होता है जिसे वो एक्सप्लेन नहीं कर सकते, बट दोज हु हैव कैंसर दे अंडरस्टैंड कि व्हाट काइंड ऑफ पेन दे हैव. So we need to like help to manage their pain, their anxiety, and their provide distractions during the treatments. तो हमें पता होनी चाहिए कि कौन कौन से केसेस के अंदर कौन कौन सी सर्जरी हो सकती है. लाइक इफ द पेशेंट इज गोइंग फॉर द कीमोथेरेपी, सो पिक लाइन इंसर्शन इज वेरी इंपॉर्टेंट, बिकॉज जैसे जैसे कीमो चलती रहती है हमारी वेन्स जो है वो ब्लॉक हो जाती है, सो यू विल नॉट बी एबल टू डू दी कैनुला इंसर्शन इन दैट, right?
Hmm.
So at the last, like with all of these things, we need to collaborate with the primary care as well, because they will come for the first, क्या कहते हैं, फॉर 6 hours, जो
Okay.
डे केयर के अंदर आए कि वो सेशन लगवाया और चले गए. सो आप उनके साथ इतना रेपो बिल्डअप कर लीजिए कि उनके साथ 1 week में भी अगर कुछ होता है तो दे विल कम एंड शेयर इट विद यू. So we have that kind of bond with them, because medical oncology and surgeon, they have that kind of mental statement ki okay, patient comes to you, they will see him, they will treat him, but what the inner self they have, they are not able to listen, और उसके लिए एक person चाहिए जिससे वो discuss कर सके. So I think as a psycho oncology we can know that part easily.
All right. Well, thank you so much, Dr. Mansi. I think a lot of people who would be in this field, उनको आपके फर्स्ट हैंड एक्सपीरियंस से भी थोड़ा आइडिया एटलीस्ट पता लगा होगा. स्पेसिफिकली द पॉइंट दैट यू मेंशन अबाउट हाउ डिफरेंट एज ग्रुप्स को कैसे मैटर करते हैं in terms of sorry, not matter करते हैं, but how to actually tackle the different age groups के different cancer treatments in terms of their mental health, and also how equally important it is to take care of the caregivers and the people like their parents and the supporting people who actually don't have cancer, because they also are equally suffering that a lot of people don't think. So once again, I would definitely suggest all the viewers, if you watched the podcast so far, and if you really like what we talked about today, Dr. Mansi is conducting a workshop slash session on psycho-oncology, and she'll be talking about much more things in depth regarding this subject. So the link to which I'll be mentioning down below in the description. If you're interested to check out the course that is being offered by Dr. Mansi, you can click the link in the description down below to register for the workshop and to see more details about the event. But once again, it was lovely having you on the podcast, Dr. Mansi. All right.
Thank you, Rishabh.
Thank you so much, ma'am.